everybody, thank you for having me out here today. My name is Julie Johnson. I actually work most of my hours out at St. Luke's East Hospital in Lee Summit, but I also work for our system offices. I'm an educator. Been doing this for about 33 years for hospitals and healthcare systems, and the last 12 years for St. Luke's. So on the back, I don't know how many are left. I had some handouts. I only thought we were going to have about 35 or 40 here, so hats off to you guys. I think I was telling Alan, I think you guys are the biggest group from a company I've spoken to all year, and without a doubt, the most men in one group. So I'm kind of starting to sweat a little bit. I'm getting a little nervous, but that's okay. We'll make it through. So today I want to talk a little bit about your health and some things that you need to know. And what I base this on is I go to the CDC and I see what they say you guys are getting sick with and what you're dying from. And that's what we're going to talk about. We'll kind of sum it all up at the end and some key steps you can do, because here's the difference between now, 2017, and say 1920, 1910. Back then, it were things that were very difficult for individuals to control that made them sick and killed them. Like flu, like typhoid, like meningitis, okay? Like accidents, malnutrition. Today, all the things that we're going to talk about, the majority of them are what we classify as lifestyle diseases. And unfortunately, what that means is we're contributing to them. So in some cases, sometimes we are our own worst enemies. I really like this little one here. This guy thinks he's got it all put together on healthy. He never sprinkles salt on his ice cream. He only eats decaffeinated pizza, and his beer is 100% fat-free. How many are with me on that one? 100% fat-free beer. Okay. I think I had one this weekend watching the cheesecake. All right, number one, it always has been in modern times and probably always will be, and that is heart disease. Basically, in heart disease, blood supply through one of our arteries in the coronary system somehow gets sort of plugged up. Okay? Just like your plumbing goes bad on you, here's your plumbing here. If the blood flow is not restored, if that interrupted blood flow is not restored pretty quickly, then things can get pretty dangerous. Severe heart attacks can result in a sudden cardiac arrest, and those are oftentimes quite fatal. So basically what you get is damage to an artery wall. So this is an artery, and this is a look inside the wall. So damage that occurs to that wall from high blood pressure, from tobacco chemicals, from your blood sugar being too highly elevated, from having high cholesterol. We have a new disease theory we call inflammation. Alan, I'm sure, is very familiar with it. We used to think bugs and germs caused all of our health issues. Now we're finding inflammation from lifestyle choices, like eating too much white flour, white sugar, not getting enough exercise, having the wrong kinds of fats in our diet. We know that causes the tissues in our body to become inflamed. And as a result, the body goes, what the heck? And it tries to fix it. Well, in this case, the fix is actually every bit as bad as the problem itself, because the body only knows one way to fix things, and that's to sort of pack on these waxy, fatty cholesterol patches to sort of smooth it over. Kind of like when you have a rough spot on your drywall and you go get some sheetrock mud and kind of wipe over it. But if you don't sand it down just right, you end up with lumps and bumps, and then when you go to paint that, you think that doesn't look very good. That's basically how our body responds to inflammation. So you've got a normal artery up here on the top right. You get a little tear, you get from high blood pressure, you get a little small rupture in that, and all of a sudden the body goes, uh-oh, I gotta fix it, and it starts packing on the cholesterol, all the fats, and over time, that artery starts to get smaller and smaller and smaller and smaller inside until finally there's not much room for blood to flow through. So clots begin to form, or chunks of that plaque break off, completely clog it, bingo, there's a heart attack right there. Okay? So this guy, I had my plumber install new pipes. I was tired about worrying about my cholesterol. So I wish it was that easy. And actually, I'll be quite honest with you, it's gotten a lot easier for our doctors to make these fixes. It's just kind of expensive and slightly painful. So we'd really like for you all to begin looking at those lifestyle choices we'll talk about in a few minutes to help prevent that. All right, first of all, signs of a heart attack, because this is such a common problem, specifically with men. Chest discomfort. It's very seldom a sharp stabbing pain. It's a tightness, a crushing sensation. I feel like there's a band tightening across my chest. Sometimes it goes away, comes back, goes away, comes back, but this uncomfortable feeling can last for a while. You can also get it in other areas of the body. It can travel up into the shoulder, back of the shoulder blade, up in the jaw, typically down the left arm, but it could be in the right. It could be dead center. Generally, it tends to be slightly left-sided because that's sort of the direction that the heart points. Okay? So those are your two key heart attack signs and symptoms. But you've also got things like shortness of breath, cold, pale, clammy skin, feeling a little nauseated, a little lightheaded, almost kind of like some flu-like symptoms. Okay? Here's the thing. If your chest discomfort lasts more than a few minutes, and I know you guys are tough. Okay, my husband's kind of a marshmallow, so he complains to me when he gets a hangnail. But most guys I know are very tough. Oh no, it couldn't be anything with my heart. I think it's a little indigestion. I ate too much barbecue last night. Here's the thing. If we don't see you in the emergency room for 3 or 4 or 5 hours, the damage is much more severe and you are less likely to survive the event. My background is cardiac rehab, so I've seen a lot of folks who delayed getting into the emergency room. Their road to recovery was a lot longer because they denied those symptoms. I want you to sit down or lie down and rest after you've called 911 or had somebody call 911 for you. If you have a plain old-fashioned aspirin, 325 milligram, like a Bayer aspirin, chew that up. That acts as an immediate blood thinner to help restore some blood flow to that area that's becoming damaged. Okay? But time is heart muscle. Do not delay, folks. Call 911. So we want you to know and control your risk factors. Some of your key risk factors for heart disease, and I'm sure Alan in his role is constantly harping on you guys on this stuff. Of what's your cholesterol, what's your blood pressure, getting them checked, getting them managed. Do you smoke? Are you diabetic? And we're going to talk about that in a few minutes because those numbers are pretty scary right now. What's your lifestyle like? Are you sedentary? And I know you work hard. Everybody works hard. I work hard. But there's a difference between working hard and getting exercise that benefits the body, especially the cardiovascular system, the brain, the lungs. So you've got to make time for that. That is critical. And this is one of the reasons why we're seeing so much more lifestyle-induced disease is because, unfortunately, with all the gyms, with all the tracker devices people are putting on their wrists, with all the home treadmills and workout equipment, we are becoming more sedentary than we ever have in our lifetime. So some key prevention, don't smoke, reducing certain kinds of fats in the diet, and I'll address that at the end. Managing your stress. The minute you get stressed out, guys, I don't know if you've heard this, there's a hormone called cortisol. Have you ever heard of cortisol? And cortisol is a very damaging hormone. So basically, if an 800-pound gorilla is standing behind me, or my St. Luke's boss, and I turn around, whoa, and I see him and I know I'm in trouble, my cortisol levels just shoot up. And that allows me to run out of here as fast as I can. It increases my blood flow. It increases impulses to my brain so that I can escape. The problem is, it starts damaging my heart and my kidneys especially, my blood vessels. So while we all tend to have small amounts of stress, followed by some larger amounts of stress, the key thing is cortisol that dumps into our system is deadly. And the other place that we get a lot of cortisol dumped into our system is when we don't get enough sleep. So I'm going to throw that out right there. Even though technically they don't list lack of sleep as a heart disease risk factor, I do. Because when you don't sleep, you have higher levels of this cortisol, which increases stress on the whole system. All right, so to prevent a heart attack, take 1 aspirin every day. Take it out for a run, take it to the gym, take it for a bike ride. So I want you to have that aspirin in your world. Keep one in your desk. Tell your wives, tell your ladies to keep it in their purse so that one is available to you. But more importantly, stay active. Keep moving. That's your #1 fight against most of these diseases that we're going to talk about today. All right, our number 2 is cancer, and I'm referring to all cancers. And I've got a list here, but the thing that surprises me, and I don't know if you knew about this. Alan, how many do we have in here, you think? About 60? About 60 people.
Yeah, 60, yeah.
Okay? All right. So, between now and the time we're all dead and gone, half of you in this room, half of us in this room will have some form of cancer. Did you guys realize that? Half of all people will develop some form. Now, some of them aren't that bad and aren't that deadly, but they're still cancer. And some of them are very deadly. So, 1 in 2 people will develop some form of cancer. For the men, prostate is the #1 type of cancer. There are several different forms that it manifests in, some that are very, very rapid growing and deadly. Generally, the earlier they're diagnosed, the more serious prostate cancer tends to be. There's also another saying, a lot of my physician friends tell me, that virtually every man that dies over the age of 80 has a certain amount of prostate disease. So a lot of guys will die with it from another cause, so those we're not as worried about. But prostate's number one, lung and the bronchial system is next, followed by colon and rectal cancer, bladder cancer, melanoma of the skin, and then we start getting down into lymphoma, kidney cancers, leukemia, oral cancer, because we're still seeing a lot of smoking and smokeless tobacco, and pancreatic cancer. So those are all of our cancers. I want to talk about some of the key cancers, though, in a minute. Despite all the prevalence that we know, the most deadly really is lung cancer, followed by colon cancer, and then prostate, and then it really starts dropping off. So lung cancer is still our most deadly one. So, the problem with lung cancer is it can take a lot of years to develop. It has virtually no signs or symptoms in its early stage. Most of the time when lung cancer is diagnosed, it's because you've gone to the doctor for another problem. You got a cough, you got a cold, you got bronchitis, you think you might have pneumonia. They do a chest x-ray, and guess what? What are all these little things that we're seeing on that chest film? So the problem is, when left undetected, that's why and how it spreads so quickly and why it's so fatal. We have a couple of basic causes for this. There's a huge hereditary link to lung cancer, that we know, and you guys can't do anything about that. But the others you can. Diet, high fat diets, high sugar diets, high refined diets, I'm going to throw fast food in there because that actually pulls in all those categories, are highly linked to lung cancer, as well as, of course, we know smoking. Okay? 90% of the lung cancers, they're saying, are directly attributable to smoking. The other 10%, in fact, I have a friend not too long ago that was just diagnosed with lung cancer. She's never smoked a day in her life. She's never really even been around a lot of smokers. Okay? But guess what? She had family history of cancer, and she had one lung cancer in the family. All right, our Surgeon General, the old one, Dr. C. Everett Koop, you know, the one that looks like the Amish guy with the funky beard and mustache and all that, that's been around forever, has said that this is the chief single avoidable cause of death in this country. I'm from the South. My family's from South Georgia. When I was a kid, I used to go out and harvest tobacco leaves. I thought that was really cool. In its raw state, tobacco smells really good. It really does. And I didn't realize how dependent my family and the society down there, the industry, was on tobacco. And then, as I got older, went to school, became an educator, started working with people, I realized what an evil product this is. And I'm not gonna sugarcoat this, guys. They do everything in their power to trap smokers into continuing to be smokers. There was a study done by the Harvard School of Medicine, lasted from 2001 to about 2011, and basically what they found was the amount of nicotine. See, there's only a certain amount of nicotine naturally occurring in tobacco. But what they found is these cigarette manufacturers were incrementally increasing the added nicotine to cigarettes over the course of 12 or 15 years to make sure that smokers stayed smokers. And guess what? It wasn't illegal. Okay? So there was about a 14% increase in nicotine content of cigarettes over about an 18 or 20 year period, until the government caught on and said, oh, no, we really don't want you doing that anymore, but then they didn't create specific legislation to stop it. Okay? So basically they're trying to keep you as their customer, which that sort of makes me mad. You know, if you're going to do something, be honest about it. But they kept that very, very quiet. So on average, cigarette smokers die 10 years earlier than their non-smoking counterparts. Okay? This does not address the quality of what those last 6 or 8 or 10 years might be before they die. This is just actual lifespan shortening. I'm really negative about smoking because I lost both my dad, my father-in-law, and one grandfather to disease directly related to smoking. So I eat cigarettes, and I encourage anyone, if you are even thinking about or considering it, go talk to Alan. I'm sure he's got tons of education material, tons of ideas, ways that you can get started. It's amazing. I teach smoking cessation. I've worked with people for a long time. It's amazing to me watching their story progress when they quit, as their body begins to heal. I'm not saying it's easy, but the strides that they make over those first 3 to 6 months as their lungs begin to heal and the rest of the respiratory system does when they give up those cigarettes. All right, colorectal cancer. This is another big one right here that we can so prevent. So men, you got to get your colonoscopy when you hit 50 years of age or sooner if your physician wants it based on your family history. All colon cancer begins as benign or non-cancerous little polyps. So that when they go in there and do that little scope, they can just clip those little things out before they ever have a chance to grow and become cancer. Okay, so while everybody hates the thought of doing that stinking, no pun intended, colonoscopy, okay, it is so critical that you get that done. That is such an easy test. And if nothing else, you're going to lose a pound or two that day or two before for the prep and everything. I think that's the worst part. Everybody hates that prep. Okay? You can talk to your physician too. There's several different kinds of preps, both liquid and pills that you swallow to help clean the system out. So if that's got you all upset, talk to your doctor about what would be the best prep for you. Okay? So any symptoms that you might come across, change in what your stool looks like, dark, tarry, changes in your bathroom habits, like dang, I used to only go once a day. Now I'm hitting that bathroom 2 or 3 times. Feeling that you can't completely empty everything out, so you got to go back. Additional gas or bloating, these can be signs. Unfortunately, by the time the signs hit us, the disease can be pretty far advanced. So this is one we can so prevent with that colonoscopy. The other thing too is critical that we improve our diet. So I'm just curious, anybody in the last week, and Alan, close your eyes because I don't want you to pick on anybody when you see the answer here. Anybody eat a fast food restaurant? McDonald's, Wendy's, Burger King, Taco Bell? Okay, you know what? I'm not going to harp on you about the fat, the refined flour, some of the other stuff that you ate. Problem with those meals is there's no fruits and veggies. And I'm sorry, the lettuce you get on a taco does not count. The pickle on the Big Mac does not count. Problem is, without fruits and veggies, you have no way to clean out your gut. That's what does it. The fruits and the veggies and the whole grain are your Roto-Rooter. They clean you out. So when you don't eat those things and you eat other things instead, all that stuff sits in there. And it's sluggish and it's toxic. So in general, now these are just guidelines. Everybody needs to talk to their physician. We want to look at one segment of the lower intestinal system, the sigmoid colon, about every 5 years, and then a full colonoscopy every 10 years, and then starting at age 50. And then some physicians really like to see you do the fecal occult stool kit, you know, where you just wipe that little smear and you mail it in. I know, I'm sorry. At least everybody's done with lunch now. At least you didn't have, you know, like nacho dip, bean dip or something, because that would have been sad. We would have stopped eating real quick. But that's a real simple test you can do to see if you have any active bleeding going on in the GI tract. So those are some things that you can have measured. Prostate cancer. We hear so much about this for men. The good news is it's not nearly as deadly as it used to be because we're pretty good at catching it now. The death rate is dramatically decreasing, and that's because I think, honestly, it's a simpler test. So you're willing to do it. Am I right? You go to your doctor, it's a simpler test than, say, a colonoscopy or a chest film and all those, so you're willing to do it. Based on your risk, your physician may ask you to be screened several ways. There's the PSA lab work. I am here to tell you right now, if any of you have an opportunity to be offered a PSA blood work just out at a community screening or something like that, it doesn't have a lot of value unless you have previous numbers to compare it to. It's done in the same lab fashion, and to be quite honest, you really need the physician exam to go with it because it's a combination of the two, not just that lab work. Not just them drawing blood or sticking your finger and you put that on a little piece of paper and they measure something. So it's really important that you work with your physician on getting these screenings done. Generally, we start getting concerned at about age 50, but depending on your risk, age 45 or even age 40, as well as family history and symptoms, will kind of help your physician decide how he wants to manage your process of screening. Okay. Often there's no symptoms until it's fairly advanced, but some symptoms might be changes in urination, difficulty starting, stopping, finishing, painful, it's weak. So any change at all in your ability to go to the bathroom. Okay? Here's another one. I know you guys don't want to hear me say this, but having trouble during sex, keeping an erection, that is a true sign of prostate cancer or benign prostatic disease where there's inflammation and swelling in that system. Okay? Pain in the spine, hips, or ribs that's like, man, I can't figure that out. I know I didn't hurt my back, but this thing just keeps hurting. That's something you want to see the physician for. Any weakness, numbness, tingling in the feet or legs, that's not always just necessarily a back or a spinal problem. That can be a sign of prostate disease. All right, the most common form of cancer, but actually one of the least deadly, is skin cancer. We basically divide it into two groups. We have melanoma, that's the deadly stuff, folks. Okay. And then we have basal and squamous cell, and those are the more disfiguring, like, man, what's that weird looking thing hanging off my ear, or on the side of my nose, or on the top of my head? Okay. While these very seldom become melanoma and become fatal, they can grow very deeply, become quite disfiguring, and take some pretty extensive surgery to remove. So, almost every form of skin cancer is either caused by or accelerated by sun exposure. And I'm looking around, and I'm seeing some receding hairlines. I'm seeing some bald on top. I'm seeing a lot of exposed ears. Folks, that is where your primary location is on cancers, because when you go outside every single day, that's what gets hit. So making sure you're wearing hats, okay, making sure you're using your sunscreen is important. If detected early, all these things can easily be removed with no problem. You don't have to wear the hat in the room because there's no sun. I just thought I'd clarify that for you, just in case. I love it when you guys take my recommendations. All right, some risk factors for your skin cancer. Of course, family history. Occupational exposure to things like tar, radium, arsenic compounds. Got a fairer skin type. So I'm looking around, I'm seeing all different skin types in here, but the fairer you are, if you were blonde-headed as a kid or a young adult, or red-headed, you're going to have more fair skin. But here's the key thing, it's exposure to UV rays, and the sun really gives us two key kinds of rays. We have the UVA and the UVB, and here's how I like to remember. The A stands for aging, and the B stands for burning. So the UVA rays are more compact and penetrating, and they go through all the layers of the skin. That's what causes us to wrinkle. See, I always get the women on that one, because women don't want to wrinkle. You guys don't care as much. But the women's like, oh, wrinkles. What do I do to prevent that? Okay, sunscreen. UVB. These are the very intense rays that move a lot. They have a lot of motion to them, so they don't penetrate as deeply in our skin, but they're the ones that cause us to turn red or blister. So those are the burning rays. This is why when you select a sunscreen, okay, it needs to be a broad spectrum that's going to block both UVA and UVB. So this is why, and anymore, it's pretty easy to do that. They've gotten rid of most of the cheap sunscreens anymore that don't do it. But the same thing for your eyes. You want any sunglasses you wear to block UVA and UVB rays. So, skin cancer for melanoma especially, but this will also work for squamous cell. There's the ABCDs. You guys ever heard this before? Have you heard ABCD for skin cancer? Okay,
yes,
maybe put it in a newsletter if you haven't. All right, so A, asymmetry. Any mole, any skin tag, anything you've got should be completely equal. So if I cut it in half, one side looks exactly like the other side. If it's asymmetrical, that's a problem. B, look at its border. If the border is nice and smooth and even, it's probably okay. But if it's got kind of a jagged or a funny edged looking border, that's oftentimes a sign of melanoma. Color. Everything that is universal in color, it's all black, all brown, all red, that's usually fine. It's when the colors start mixing and it looks a little artistic, now we got a problem. And D, diameter. So if you think of a number 2 pencil, you know, the eraser, the little round eraser end of number 2 pencil, anything that grows bigger than that, okay, when it wasn't originally, that's a sign. So we say A, B, C, D, asymmetry, border, color, and diameter. So take a quick look at your skin. Do your own little skin checks every once in a while. If you've got anything you're not sure about, show them to your primary care physician. If you've got a lot of them, if you have a family history, you probably ought to have a dermatologist to do skin mapping and skin checks on you. So our big thing is see your physician regularly, follow all the screening schedules that we've talked about for cancer so far. Tobacco, really think about giving that up if you're still a tobacco user. That includes smokeless tobacco. Limit that sun exposure, and when I say limit exposure, I'm not saying don't be outside, I'm just saying cover up the skin. Limit the high saturated fats. We know that saturated fats coming from the junk foods, from the fast foods, from the low quality animal products, from the pre-processed. So basically if it comes in a package, if it's got a wrapper on it, I'm going to say it's pretty processed. Okay? Apples don't come in a package. Okay? So we want to make sure that we're reducing those saturated fats. Also, and think about this. So I want you to think back to yesterday. Let's go back to yesterday. A serving of fruits or veggies is 1/2 cup. That's not very big. That's about half of a large apple, or that's maybe a small peach or a small banana, a full cup of green salad. So go through your head real quick, breakfast, lunch, dinner, snacks. How many 1/2 cup servings of fruits, veggies did you have yesterday? Because I'm going to ask you guys to raise hands a little bit. I'm just kind of anxious at the end to see what that number is. So kind of start thinking about that. So eating 8 or more 1/2 cup servings, or at least 4 full cups of fruits and veggies a day, and getting that exercise. These are the things that prevent cancer. All right, number 3, accidental death and injury. This actually rose from when I first put this presentation together about 14 years ago. This was down around 5 or 6. It's risen back up on the charts. It's funny, this was one of the most common things back in the 1920s and 30s, and then it dropped way down, and then it's come back up again, which is kind of interesting. Well, you think about it. Right now, poisoning and drug overdoses in this country are skyrocketing, both intentional and accidental. Motor vehicle accidents, like driving under the influence, but now we have all these other ones. Fatigued driving, distracted driving, with cell phone, with eating. People are using their phones all the time. I don't care what they say they don't. I drive on the highway all the time back and forth to work. I see into people's cars. I see what they're doing. They scare me to death. Or they're on the phone, they're eating and drinking coffee at the same time. Or ladies are putting on their mascara while they're going 60 miles an hour on the highway. It's kind of scary. Falls. We're seeing more older adults with debilitating falls in older years. And firearms, going back up again. So this is our number 3 cause of death, whether you want to call that lifestyle disease, lifestyle related. I think there's definitely some correlation in some of those. All right, our number 4 is respiratory disease. So diseases of your lungs and the respiratory tract. We kind of renamed one of them. We used to call it, have you guys ever heard of COPD? Okay, it has a new name. I don't know why they have to rename this stuff all the time. It confuses me. It's now called CLPD, chronic lower pulmonary disease. So things like emphysema, chronic bronchitis, asthma, basically what it does over time is it scars the lungs, just like smoking does. So making sure that if you have family history of respiratory disease, you have exposures that have caused disease, you have chronic asthma, you've had emphysema, but you think it's pretty well under control, stay in touch with your physician, with your pulmonologist, to make sure that you are not advancing into further stages. And of course, smoking, including passive smoking. So if you hang around with 4 or 5 people and their favorite thing is to go to the bar and have a drink, and you're inhaling all that secondhand smoke, that's every bit as dangerous. And then of course we have all the environmental causes. So this is our number 4, is respiratory disease, and it's worked its way up over the last 14 years. All right, number 5 is stroke. This has actually come down on the list. A few years ago, this was at number 4, so it's come down. There are 2 types of stroke. So anybody here have a family member, friend, somebody you know have a stroke? Okay. Stroke is still the 3rd leading cause of disability, okay, especially among older folks. Ischemic stroke, so an artery gets blocked, much like the coronary artery. Remember how I went through that? It got blocked, only now it's in the brain. So if you have an artery gets blocked in the brain, that's an ischemic stroke. That's about 85% of strokes. The other 15% are hemorrhagic. Unfortunately, that's what my father-in-law died from a few years back. A blood vessel broke in the brain and it bled out. And that's about 15%. Sometimes those are caused from congenital defects, but we definitely know that in those types of strokes, lifestyle choices can cause those weakened areas in the brain's arteries. So we have a very quick way to recognize stroke fast. All right, face. So you look at somebody's face. So give me a big smile. Oh, he's got a nice smile. All right, so both sides of his mouth went up. His eyes kind of lit up. Okay? But if only 1/2 of the face responds to the smile and the other half doesn't, that's a pretty high indicator for stroke. So face. Face drooping, face weakness, inability to smile. Arm weakness. My paramedic buddies, we call this the Frankenstein test. Have them put their arms out. If one arm can't keep up with that other arm, and especially if that arm matches the side of the face that's sliding down and drooping or can't smile, I pretty much guarantee you that's about 100% positive for stroke. Okay, so smile, do the Frankenstein, and then speech. Oftentimes people suffering a stroke have an inability to speak, slurred speech, a change in their speech ability. So ask them to say something. Ask them to answer some simple questions like, can I borrow $100? See if you get a response out of them. All right, if you see any face, arm, or speech problems, it's time to call 911. So we've made this really simple, fast, and it works. We're getting more people in the emergency room, and if we can get you, for example, I know, I can't speak for other hospital systems because I know ours, at any of our St. Luke's hospitals, if you can get somebody into the emergency within 3 to 4 hours of any sort of disease, of any sort of stroke symptom onset, we can go in there, dissolve the clot, retrieve the clot, and I have seen people walk out of that hospital literally 3 days later with 0 impairment. But if they wait an extra half hour, those two things, clot retrieval and dissolving the clots, those come off the table. And now this person is facing months, even years of disability, being in rehab. So spot that stroke quickly, call 911, get them to an emergency room. I cannot tell you how important that is. So some other things that you might see with stroke: sudden trouble walking, dizziness, loss of balance and coordination, one eye doesn't seem to be able to see as well, or a sudden severe headache onset. Time is brain. Call 911. So your key risk factors for stroke: high blood pressure, having high cholesterol. Smokers have a significantly increased risk of stroke. Being diabetic, having any sort of heart disease, because if the arteries are clogged in the heart, they're probably clogged in the brain too. Atrial fibrillation, which is an abnormal heart rhythm that allows small blood clots to form behind some of the valves of the heart. Those can travel up to the brain. Use of alcohol and drugs can create stroke situations, and certain kinds of blood disorders. All right, number 6 on our list is diabetes. This one blows my mind. I've been in healthcare for 33 years, and I remember one of my first education presentations I ever did was on diabetes. And I can tell you the numbers. Back then, our diabetic population was only 4%. 4% of people were diagnosed with diabetes in the late 80s, when actually this will be in the early to mid 80s. Now, 10% of our population has already been diagnosed as diabetic. 35% of our population is pre-diabetic, meaning their levels are out of whack enough that if they don't do something, they will become diabetic. In fact, 70% of them, they're predicting, will become diabetic. We are just seeing the tip of the iceberg on this disease process, and this is what's going to ruin our families, our health, our country, probably faster than any other disease. Okay? The number one associated risk for diabetes is how much you weigh. Okay? Having that extra 20, 30, 40 pounds, sometimes, and I work with patients, sometimes even losing 10 pounds, we see a dramatic increase in their blood sugars and their hemoglobin A1Cs, which is a measure of your blood sugar over about a 3 or 4 month time. Okay? So here's one thing that you can do really quick. Measuring at your belly button, your waist for men should be under 40 inches, or a slightly stricter thing would be half of your height. So if you are exactly 6 feet tall, which is what, 72 inches, divide 72 in half, so that's about 36 or so is what your waist circumference should be. So the shorter you are, the smaller your waist needs to be. The taller you are, you get a little bit extra. But at least under 40 inches. This is one of the things that is most tightly correlated to the development of diabetes. So some of the other signs and symptoms: frequent urination, really thirsty all the time. Dang, my mouth feels like cotton, I gotta go get something to drink. Extreme hunger, unusual weight loss that you can't explain. Everybody always thinks weight loss, that's a good thing, right? Well, not always. Fatigue, sores that won't heal, especially on your hands, feet, and ankles, or up in your scalp, because you've got a change in blood flow and a change in nerves. Blurry vision and irritability. So based on that list, I'm sure I'm diabetic, especially if you go with that last one, irritability. All right. So this doctor says, so you went camping and a bear mistook your blood for honey. Would you mind if I ordered a diabetes test for you? All right, Key thing with diabetes prevention, guys, lose some weight. Like I said, it's not that you've got to lose 50 pounds, you got to get to this ideal weight, which I'm sure Alan would love if you did that. But you know what? Losing 5, even 10 pounds, we see immediate improvements in your blood sugar control and your hemoglobin A1C. Reduce the refined carbohydrates, and there's two, white flour and sugar. There's an old saying, the whiter your bread, the sooner you'll be dead. Has anybody ever heard that one? I kind of like that. That's from a book called Food Rules. So we want to eat stuff that's whole grain, stuff that's less processed, things that's closer to the field. Our body's got to work to digest it. It doesn't have to work much. Plus, the sugar and the white flour cause inflammation. And guess what? Inflammation is highly correlated not only to heart disease and stroke, but also to diabetes. And here's the key thing that we talked about earlier about the exercise. We know that 30 minutes of exercise per day is highly protective against diabetes. All right, this is a tough one, and I'm certainly not a mental health expert. Actually, I could use my own mental health expert at times, but number 7, this is pretty surprising. This has slowly been climbing the list over the last 20 or 30 years. This wasn't even on the list back in the 60s or the 70s. Suicide is the number 7 cause of death and injury in men. And that's simply because you guys are tough and you're less likely to go seek help than women are. You know, women want to talk their feelings out. If anybody wants to stay after, we can talk our feelings out after, but that's not something men do, right? Am I right? You guys are very quiet. Okay. So, depression, drug use, also an issue. Sleep disorders, and that's something that we've seen on the rise. More and more people, you heard of sleep apnea, where you're lying there and all of a sudden your breathing stops because extra tissue, the tongue kind of blocked the back of the airway. Unfortunately, lack of good sleep contributes to depression and high cortisol levels that we talked about. So that's a whole topic by itself, just sleep. And the fact that men kind of tend to deny, no, I'm tough, I got a job to do, I got to provide for my family, I got to get to work, I don't have time for this. I really encourage you, and I know, because I asked Alan very specifically, do you have an EAP here? And he said, yeah, we do. We have an EAP here, and I've got information on your sheet if you turn it over. So there is information about your EAP program. They don't know. We have an EAP program through St. Luke's, and we work with companies. You guys don't have ours, and that's okay. I don't mind. I won't hold it against you. But here's the thing. Everybody's always worried, well, what if my company finds out I called the EAP? That doesn't happen. Basically, that's HIPAA, just the same way as your company can't get a hold of your private medical records from your physician. This is private. It's a benefit. Folks, if you need it, use it. All right, number 8. Here's another surprising one. This has jumped on the list in the last 10 or 12 years, Alzheimer's. Alzheimer's is the most common form of dementia. Currently, 5 million Americans have it. 10% of Americans over 65. You guys dodged a bullet here because 2/3 of them are us women. So, but this is an abnormal buildup of a certain kind of plaque. It's called an amyloid protein. And it gets in our brain cell fibers and it twists around our working brain cells. So all of a sudden those brain cells don't work quite as well. And over time it kills them off. It reduces the brain mass. There's pictures. And it's really scary to me to see the brain imaging of an Alzheimer's patient versus an average person. And of course the definition of average depends on who you're talking about here. But their brain shrinks. It's smaller. There's more dead space inside the skull. There is definitely a correlation to the food. So everything I've talked about processed food, wheats, too much wheat and sugar, inactivity, and another thing is isolation. So as we age and people tend to get isolated as their kids grow up and move away, you quit work and you retire. That's all correlated to it as well. So here's some key prevention. Antioxidant foods, and basically anything that is bright colored, like a red pepper, purple blueberries, oranges, anything that's got bright green, spinach, kale. Would you feed them kale at the next lunch and learn?
Well, they won't show up, but
okay.
yes.
We don't have to tell them. We don't have to tell them. Green tea. So how many of you drink tea? Okay. Okay, do this for me. How about half of your tea that you drink, switch it over to green tea, because there's a chemical property in green tea that protects the brain. So just switch half your tea over to green tea. Even if you put a spoon of sugar in, I don't care. Switch half of it to green tea. Cut the refined flours and the bad fats that we've already kind of talked about. Exercise. Ooh, sleep. Are we starting to hear the same words over and over again? I think we are. Stay sharp with mental challenges throughout your life. Sometimes for me, just getting up in the morning and putting on my shoes, making sure they're the same ones are a big challenge for me. So we need to make sure that we're keeping our brain sharp, okay? Anybody works those Sudoku puzzles? I hate those things. I'm terrible at them, but I still work them. All right, number 9, influenza pneumonia. This is so incredibly preventable. How many of you get a flu shot? Okay. If I come back next year, I'll ask that question again. I want to see more hands up. Getting a flu shot is the single best way to prevent the life-threatening influenzas that are going to hospitalize you or cause pneumonia. And then once you're 65 or older, getting the double pneumonia vaccine. There's 2 of them now. We are saving lives with this. I think everybody's really concerned, oh, I don't believe in shots. I've never had the flu the day of my life. You know, or I took a flu shot and it gave me a really bad flu. Well, first of all, the flu shot can't give you the flu because it's not active live virus. It can give you flu-like symptoms because your immune system is revving up to it. If you have a reaction like that to flu vaccine and you feel like you're getting the flu, that's good. It means it stirred up your immune system. Now, you're not going to prevent all forms of flu. Every year, the flu vaccine is targeted for the 4 worst flus that they think are going to kill the most people. There's like 190 strains of flu vaccine. I don't know, I pulled that number out of thin air. I have no idea how many there are. But it only is going to protect against the 4 key. So yes, you can still sometimes get the flu even though you had the flu vaccine. But usually, if you had the flu vaccine, any flu virus you get, you're not going to be quite as sick from it as if you had no flu vaccine at all. So get your flu shot. Are you guys doing flu shots here?
Next 1 month from tomorrow.
Excellent.
And then 4 weeks from tomorrow, and then another one the next week.
Great.
So
okay.
Make sure you guys keep an eye out for that. I'll get more information out.
Perfect. And if you have chronic disease, heart, lung, cancer, diabetes, sometimes it's better to talk to your physician and get your flu shot a little early in the flu season because you're the ones that tend to get hit first that get the flu season rolling. So people who have chronic disease, we don't mind if you get yours a little earlier in mid to late September, even early October. And then if you're pretty healthy, you can get your flu vaccine anywhere from the middle of October. We usually have the healthier people wait a little bit longer, and we do it from about mid-October till about the middle of December for the healthier folks. All right, and our last disease here is liver disease. This is brand new. Just jumped onto the scene here recently, and that's because of the dramatic increase in diagnosis of hepatitis B and C in our population. Prior to 1985 for hepatitis B and about 1990 for hepatitis C, our blood supply, when we donated blood, when we got transfusions, was not checked for these 2 things because we didn't think it was that prevalent. So my generation of folks in their 50s and now going into their 60s that had blood transfusions or blood products in the 60s, 70s, early 80s could have received hepatitis B and C and don't know it. So if you had a blood transfusion prior to 1990, that's something to talk to your doctor about. And they can do a very simple blood test, especially for hepatitis C, which lies dormant for a very, very long time, but it can damage the liver. We've all heard of cirrhosis of the liver. That's basically just kind of a breakdown of liver tissue, and it's caused by alcohol consumption. We've all heard that. But did you know that eating a fatty diet can also cause cirrhosis of the liver, just like drinking too much beer or whiskey or wine? High blood pressure damages your liver, diabetes, and being overweight. Also, the overuse of aspirin and ibuprofen is especially kind of hard on the liver. So if you, chronic aches and pains, instead of just popping ibuprofen all the time, talk to your doctor maybe about a better treatment regime for chronic minor muscle aches and pains instead of always popping aspirin and ibuprofen. All right, so there's our top 10 diseases. Were there any surprises in there? A few of them we didn't expect to see. Well, let's talk about what you can do. I've tried to summarize a lot of this on your sheet. But number 1, it's up to you. It's not up to me. It's not up to your wellness coordinator. It's not up to your wife or your kids. It's not up to your doctor. It's up to you to accept responsibility for your health and say, I'm not going to let those diseases catch me off guard. I'm going to be proactive. I'm going to develop a plan. Okay? So Julie challenged me to drink green tea. Well, maybe that's just one change you could make now and just deal with that for a month or so. Hey, that wasn't too bad. I think I remember her saying eat 8 half-cup servings of fruits and veggies. Well, let me see if I can at least get 3 or 4 in, and maybe 5 after that. So develop a plan on how you're going to improve your health. Have a primary care physician. Does everybody have a primary care physician? Okay, Okay, that is critical. In this day and age, you got to know your doctor's got to know you, which is harder than ever before because doctors have more patient loads than they've ever had. So doctors don't know us like they did when some of us were growing up. So you've got to be proactive because guess what? They're not going to be proactive and come after you. Get those regular checkups. Those are critical. Do not, I'm feeling pretty good. I think I'll blow off going to see my physician. See, you guys do on-site health screenings, right? And that's wonderful. I love that because you're catching a lot of stuff early, but you still need to see your physician because there's things that they can't screen here too. So I want you seeing your physician. I love this one because I think this so sums up men. If you hadn't done those tests to find out what's wrong with me, I'd still be healthy, right? Am I right? What you don't know can't hurt you. All right, number 5. Know your key health numbers. You guys are already doing that, so I'm not going to harp on this one. Your blood pressure should be below 120 and below 80 for that bottom number. Your total cholesterol should be under 200 with that good protective HDL at least 40, and I really like to see that up at 50. Exercise is the best way to do it. LDL should be under 100. If you're really healthy, you don't have any risk factors, we'll be a little lenient, maybe let you go up a little closer to as much as 130, but we're shooting for that 100 number for the LDL. Your fasting blood sugar should be between 60 and 100. Your body mass index, which a lot of people hate that one, I do, that's the height to weight ratio. It's just a general measurement tool, don't be afraid of it. Our body mass index should be around 27 or less, and then your waist circumference should be under 40. So those are some of your key numbers. All right, regular activity, and I kind of already talked about this. You need to get out and move. 30 minutes most days of the week. It doesn't have to be all walking. If you want to get, maybe, how about starting a yoga class?
We have yoga.
Yes,
We
Tai
have lunch
Chi.
classes every day.
I like the way they move in Tai Chi. I've always wanted to learn that. I'm afraid I would look more like the robot from the 1970s though. Get comfortably out of breath when you're exercising. A little strength training, use some dumbbells. Just get some simple stuff. Get an exercise tube. A little bit of light stretching. Do a little bit of everything. Eat smart and manage your weight. More whole grains, less refined white. Enriched flours and sugar. We've got to change our diet. We are now eating for disease. We are not eating for health. Reduce the saturated animal fats. I love a good steak, but you know what? I try and limit my portion size, and I still have that steak. I try and make sure that it's grass-fed, 100% grass-fed. I'm very picky about where I buy my meat. I'm willing to pay a little bit more for it because I'm eating a little bit less. Grass-fed beef has a higher omega-3 content level and a lower saturated fat content. Okay? It's actually a little healthier for us. I try to eat fish a little more often. How many of you like salmon? Okay. All right, eat salmon a time or two a week. Eat more fruits and veggies. So how many half-cup servings a day are you shooting for? 8. That's right, you're going to remember that number. Drink more water. Most of us go around in a chronic state of dehydration. Dehydration mimics hunger, and you tend to snack more. Most of the time, we could stop that feeling of hunger just by drinking a glass of water. And portion control. And this is the thing that really bugs me about you guys. Us women, we can cut down on what's on our plate, and we might lose like a thimbleful of fat. You guys cut back on your eating a little bit, and you drop like 8 pounds in 3 days. It's amazing to me. It's just the difference in your metabolisms. You guys have testosterone, and we don't. So just cut back on your portion sizes a little bit if you want to try and lose weight. You don't have to go on a diet. Stress management. Key stress management tools are exercise, doing fun stuff, a little bit of organization and time management too. And I have what I call my islands of peace. How many islands of peace do you build into your day, every day? An island of peace might be a 5-minute walk. It might be, hey, I'm just going to go over here and sit in the dark corner for 5 minutes, and I'm just going to chill, and I don't want to talk to anybody. It might be reading a book. It might be watching a favorite movie. Find some islands of peace every single day. And proper self-care. Use your medicines correctly. If you're on a prescription, take it as the doctor tells you to. Basic first aid care. If you have a cut or a scrape, don't just, suck it up and stick a Band-Aid on it. Wash it out carefully and properly to prevent infection. Seek the appropriate medical attention. Get 7 to 8 hours of sleep every night. And I know there's some of you are going to say, yeah, I only need 5 hours. That's garbage. The majority of studies tell us, even the people who function routinely on only 5 hours of sleep at night, it's doing that Alzheimer's damage. It's doing the cardiovascular and respiratory disease damage. Use your sunscreen, an SPF of at least 30, especially on those areas that get lots of extra sun. And the regular checkups and age-recommended screenings and tests from your physician. And finally, understand your benefits. You guys have some phenomenal benefits here with your company. You've got your employee assistance program. I've got the phone number on the back of your sheet. Cigna has lots of health resources for you. Most people totally ignore what's on their insurance website. You've got lots of information. They probably even have discount programs for things that you can do. Financial planning is also financial health and wellness. That helps with stress. So you've got Principal, and there's their phone number and website, so that's all on that back sheet. All of this pulls together, guys, in your total health. So I'm challenging you right now to raise your hand. Let's go to your fruits and veggies. Remember I asked you, how many half-cup servings, how many, and I said 8, how many reached 8 half-cup servings yesterday? I'm impressed. I very seldom get more than 1 hand, maybe 2. How many of you got 4 or more? Okay, those of you that are 4 or more, go to that next level. Make sure you get 5 or even 6. How many of you 2 or more? Who got at least 2? So that should be everybody that's already raised their hand once. Okay? So whatever you think you did, tomorrow, today, eat 1 serving more. I'm not asking for the world. Don't go to 8. Maybe just add 1 or 2 more. So do a few things that you think you can change. Pick 1, 2 things for the week to focus on. Green tea, extra serving of fruit or veggies. I'm going to walk on Mondays when I get home. Every Monday night, I'm going to go out and take a walk. Pick little things that you can change. All right, I thank you guys for putting up with me. What questions do you have? Do you have anything? This is a lot of information in 50 minutes.
I have one thing I'd like you to touch on just briefly. Next year's focus on wellness is going to be Drive for 5, understanding the key risks for metabolic syndrome. So it ties into everything you've already discussed, but can you just give them a quick overview of what metabolic syndrome is?
Yeah. So you know how we talked about all these numbers. I threw out key terms like cholesterol. I think I mentioned blood sugar. We talked about waist circumference and body mass index. Triglycerides, which I think I had up here once or twice. These are all key measurements of how your metabolism affects your health. In metabolic syndrome, you have not 1, not 2, but usually 3, 4, or even 5 of these measures enough out of whack that it is hosing up your liver, your cardiovascular system, your heart and your arteries, your brain. And we know that if we can get those things managed, we can get those numbers down and controlled, whether it's with lifestyle changes or working with your physician on medications, then we know that we can reduce your risk of dying from these diseases we've talked about that were excelling. Metabolic disease by itself is not a new disease. It's a compilation of multiple problems that in this society we see. Metabolic disease did not exist 30 years ago, 40 years ago. We never even thought about it because you didn't have people with out of whack cholesterols, triglycerides, diabetes, and being overweight. We didn't have that. Now we do. So, I challenge you to, again, think about those little individual things you can do. Those are all going to chip away at the development of that metabolic disorder, metabolic disease. Did that answer your question? Okay. What else? All right. I think everybody's in a food coma. I'm going to hang around for a few minutes. If you have a question for me, please feel free to come up. Thanks for your time, guys. I appreciate you being here today.